Hello, everyone. So if any of you don't know me, my name is Dr. Cooper. I am one of the physicians here at Living Wellness Medical Center. And today I am so excited to talk to you all about menstrual cycle tracking and the Fertility Awareness Method. I have been talking about this with my patients for forever, but really the last few months, I feel like day after day, I am going over how to cycle track, what the Fertility Awareness Method is. And so I wanted to take some time to make a more in-depth presentation that I can send my patients to, and hopefully you all that are watching now can get some information for it as well. So we will go ahead and dive right in. All right, so an overview for today. We're going to touch on anatomy and just go over basic female reproductive tract anatomy so we can keep that in mind when I might reference, the ovaries later on. I will define the menstrual cycle. We will cover what to track. So that's going to be basal body temperature, cervical mucus, cervical position, and then I'll talk about LH strips. So this is something that's not always necessary and part of, fertility awareness, but a lot of my patients like it. They're using it. Touch a little bit on LH strips, what they are, how to use them, what are some of the pros and cons, and then we'll talk a little bit about how PCOS can make it difficult to track if you have PCOS, and then at the end, some ways to assess and then also optimize hormones and ovulation. And then at the very end, I will give some resources to you all, some books, some podcasts that you can listen to and read more about fertility awareness and cycle tracking. So here is the anatomy. We have our two ovaries, one on the right side, one on the left side. This is where different follicles get to develop during our menstrual cycle, really in the follicular phase, which we'll talk about soon. And then we have the fallopian tube. So during ovulation, the dominant egg gets to be released into the fallopian tube and it waits around in the fallopian tube to see if it's going to get fertilized by sperm or if it's just going to go to the uterus and die off. And then we have the uterus right in the middle. I don't know if you all can see my mouse. But if you can, right now, I'm kind of highlighting the cervix. So here is the cervix. This changes position. It changes texture. It changes mostly in texture, I'm meaning like soft or firm. And it changes throughout the cycle as well. So we'll touch on that later. And then the cervix connects to the vagina. And the vagina, we have the vaginal canal that then goes to the external vulva. So there's just some basic anatomy. Defining the cycle. So a lot of times I'll ask my patients, how long are your cycles? What I'm really looking for is what is the time between menstrual cycles? So is it 23 days? Is it 28 days? Not necessarily how long are you bleeding and how long is your period or your menses lasting. So to determine how long your cycle is, you count day one, which is your first day of a true period. So first day of bleeding where you need to do something about it. So not just a little spotting, but, oh, this is a bleed. You need to either use a cup, use a pad, use a tampon, use some of the period underwear. So that's going to be day one. And then you count every single day. So then it'd be cycle day one, cycle day two, all the way up until the day before your next period starts. So that will tell you how long your cycles typically are. The average is 28 days. However, some women, they vary month to month. They should be, within 3 to 5 days of each other. If they're going longer than that, then that is a sign that you have an irregular cycle and you should talk to your provider about that. And again, the average is 28 days. But it doesn't have to be 28 days. A 26-day cycle is totally normal. A 32-day cycle is totally normal in terms of the days. What's happening within those days can tell us even more information, and that's why I love cycle tracking and the Fertility Awareness Method. So we have different phases of the cycle. We have menstruation, so that's also called your period. That's also called menses. So going to be the length of time that you're bleeding. So on average, again, about 3 to 7 days. You should have a day where it's a little bit medium, in blood flow. Shouldn't be light the entire cycle. So you should have to do something about it in terms of, Even if you're using period underwear and you don't need to change it, that's okay. But if there's just a little bit of spotting on a pad, that's usually a sign that there's something going on and something that you should talk to your provider about. Could be low estrogen if your cycles are very, very, very light. And then we have our follicular phase. So the follicular phase contains menstruation. The follicular phase is that first half of the cycle. Now this phase can vary. We don't have a set point where we say it needs to be 14 days or it needs to be 16 days. So that's going to depend on when you ovulate. So ovulation marks that transition into then the luteal phase. So ovulation really is just a 12 to 24-hour event when that egg gets released from the follicle in the ovary. So that egg stays around for 12 to 24 hours, waits around to see, am I going to get fertilized or am I not? And then next we have the luteal phase. So the luteal phase is that second half of the cycle. In this luteal phase, this is where our hormone progesterone is dominant, and we'll go into much more detail about progesterone soon when we're talking about basal body tracking. And so progesterone is dominant in that luteal phase. That first half of the phase, estrogen is more dominant. And so the next graph that I have will show those hormones in more detail than the ones listed here. This is just a general overview. And then I liked this chart on the right because it shows, you can see the little green, I'm guessing that these are little follicles there in the ovaries, and that's the follicular phase as multiple different follicles are developing with an egg contained inside of them, and then one becomes the dominant follicle that's going to release that egg. And so the egg gets released during ovulation, so you'll see that little arrow here in number 2. Number 3, this is during the luteal phase, so that egg is kind of hanging out for just a little bit to see, okay, am I staying? Am I going? At this time, this would be when implantation is typically occurring, when the egg is already fertilized. Because again, the egg gets fertilized in the fallopian tube, then it travels down to the uterus. And then the 4th phase is menstruation. So if no implantation occurs and no fertilization occurs, then that lining of the uterus is going to slough off and you're going to have your period. So these are the different phases. And then this next chart, I know this is overwhelming, but it's so, so interesting. And again, I love going over this information with my patients. They usually appreciate it. So I hope you all appreciate it that are watching right now. So I also wanted to highlight that the menstrual cycle is being coined as the 5th vital sign because of how important it is. It is so important. It really is a representation of health. And so when you are seeing your physician, it should be a question that you're asked or that you're talking about because, again, it's important. It can tell us so much about what's happening in the body. So as I talked about earlier, we have, if you look at the top of this graph on the left, we have the growing follicles. This is, again, just showing the one that gets released, but there's multiple that are growing during this time. So this growing follicle is being stimulated by FSH. So FSH, follicle stimulating hormone, given its name for what it does. So it stimulates the follicles to grow. That is released from the brain, communicates to the ovaries to tell it what to do. And then as this follicle is developing, the ovaries are releasing increasing amounts of estrogen. And so estrogen, which you'll see better in this graph to the right, is this yellow line. So you'll see during menstruation, estrogen is very low. Progesterone is always also very low at menstruation. And then after menstruation, estrogen starts to climb as this follicle is developing. Estrogen helps make abundant cervical mucus. So estrogen is what stimulates the cervical mucus to be produced, which again, we'll talk about in more detail in a few slides. And then estrogen, again, climbs very, very high. And then that growing estrogen is what's going to trigger LH to be released from the brain, telling the ovaries what to do. That growing LH is going to tell the ovaries, okay, it's time to ovulate. It's time to release an egg from the follicle. So LH here stimulates ovulation to happen. And then we have really the main event of the cycle where an egg gets released from the follicle. And then again, it's alive for 12 to 24 hours, waiting around, seeing if there's any sperm or not. So after the egg gets released, then think of this as a little shell. So a little shell that the egg once was in. This is called the corpus luteum. The corpus luteum starts to degrade, and the degradation of this corpus luteum is what causes progesterone to be the dominant hormone in the second half of the cycle, in the luteal phase. So first half of the cycle, this is on average. Estrogen, I like to think of it as the red, fiery hormone. So it might make you feel more confident. It might make you feel a little bit more energized during that first half of your cycle after your period ends. And then when progesterone takes over, progesterone is more of our anti-anxiety or calming hormone. So some women feel a little bit more sleepy, tired during that second half of the cycle. And those hormones are there in balance. So estrogen is a grower. Progesterone keeps estrogen in check. Progesterone also helps to stimulate the lining of the uterus to make it really cushiony for implantation to happen, if implantation is going to happen. So if you get pregnant, progesterone is going to stay high and it's not going to drop off. When it drops off, along with estrogen coming down, that is what stimulates a menstrual cycle to happen. And so this is an important point too, that a true menstrual cycle needs to occur from ovulation taking place. So if ovulation doesn't take place, you can still have an anovulatory bleed, meaning that you didn't ovulate, but you still had a cycle. Or in terms of if someone is on the birth control pill, they are more so having a withdrawal bleed, because when you're on the birth control pill, your levels of estrogen and progesterone are just, I don't want to say flatlined, but they're just steady. They're steady for those 3 weeks. Then you take those placebo pills, meaning they don't have the hormone in them, and that's going to drop off the hormones and cause a bleed to occur. So it's technically not a true period. It's technically just a withdrawal bleed, because a true menstrual bleed needs to occur from ovulation taking place. So that's something that I like to talk to my patients about, just because, the way that we're educated, we might not know that. We don't even learn a lot of this information in our health classes and our science classes. So it's important to know the difference between, a withdrawal bleed and then a true menstrual cycle, because I do have a lot of women that have been on the pill for 5, 10 years. They come off and they think during that whole time that their periods were regulated by the pill and that their periods are going to persist and be normal because they're used to getting that bleed every month. And then they come off and their period doesn't come for a certain amount of months, or they start having irregular cycles. And really that underlying condition that might have been there when they went on the pill is rearing its head. So again, another important thing, again, no shade to the pill, I'm not saying that, but it's important to know the differences. Okay, fertility awareness versus the rhythm method. This is also very important, because the rhythm method is just using the days of your menstrual cycle to predict when you are ovulating without using other methods to determine when your fertile window is and to determine when you actually ovulated. So if you're using an app and you're only plugging in the days that you bleed, and then that app tells you, oh, you're likely going to ovulate on day 14 or day 16, that's not necessarily true. So the app is just taking the middle ground of your cycle. If, again, you're not inputting any other data such as temperature, cervical mucus, etc., if you're only inputting the days that you're bleeding and then using that to predict when ovulation is occurring, that is the rhythm method. It is not nearly as accurate, and it's not nearly as effective as fertility awareness for both trying to conceive and then also actively trying to avoid pregnancy. So fertility awareness takes into account 3 main things. So that's basal body temperature, cervical mucus, and cervical position. And additional is the LH strips, or the ovulation predictor kits, that we'll talk about. That's, again, not commonly in the fertility awareness method, but it can be used. So we'll dive in a little bit more into that. Basal body temperature. This is very, very important to track if you're using the fertility awareness method. So basal body temperature is our lowest temperature obtained at rest or as you're sleeping. And so the best time to take your basal body temperature is right when you wake up in the morning, or some devices track your temperature while you're sleeping, so then you don't have to take it first thing in the morning. It's very important, if you are using a oral thermometer, And I'll provide some resources on the next page for different thermometers, different wearable devices. It's very important if you are using an oral thermometer or a vaginal thermometer that you use it at the same time every day, because our temperature is going to increase slightly as the hours go on. And so what this information can tell you is it can confirm that ovulation happened. How it does that is that progesterone itself is thermogenic, meaning that it's going to increase your basal body temperature by about 0.5 degree or 1 degree. It's going to increase your metabolism during the luteal phase, which is during that second half of your cycle. So you'll see on this graph here that during this follicular phase, so this follicular phase is, again, from menstruation all the way to when ovulation happens, this is where temperatures are on the lower end. So you'll see there that they're pretty steady. They can fluctuate a little bit, but they're pretty steady and they're under a line. This line is either put there based on an app. You can put it there yourself. You're going to do it after those other numbers are entered. It's not going to happen before, because your cycle can change month to month. Your temperatures can change a little bit month to month as well. So you'll see that right now during the follicular phase, progesterone is not the dominant hormone. Estrogen is the dominant hormone. So your temperatures are on that lower end. And then you will see a steady increase. So you'll see an immediate increase in temperature, and then you'll see a steady increase thereafter. The most important thing to know here is there is a rule that these 3 temperatures, so you'll see here number 1, number 2, number 3, need to be higher than the previous 6 temperatures for ovulation to be confirmed. If you have a spike and then it goes back down, that's not confirming ovulation. So you can have some spikes throughout the cycle, but it needs to be a sustained rise. And then you want to see it go up even more as more progesterone is being secreted from that degrading corpus luteum, and then it starts to come down as you're approaching your period. Some individuals, it comes down the day that they're on their period, and other individuals, it comes down, a few days prior. So this is kind of a classic basal body temperature chart. And let's see if there's anything else that I want to talk about on this slide. Really just the 3-6 rule. So again, what that means is your 3 temperatures here after ovulation tells you that you ovulated when they're higher than the prior 6. So keep that in mind. And then also what's very important about this is that this tells you, hey, you just ovulated yesterday, because you're not going to see that temperature increase until that next day. And so if you're using this to try to get pregnant, it's not too late, but a little late to use that to say, oh, now we should start having intercourse, because you really should have had intercourse those 3 to 5 days prior, because again, sometimes the egg only lasts around for 12 hours. So if there's no sperm there to fertilize that egg and you find out, 12 to 24 hours later that you ovulated, it might be too late. So basal body temperature is helpful to confirm ovulation, not to predict ovulation. So you don't want to use it to predict your next cycle's ovulation, because again, that changes. So here are some different devices. I do not have any affiliation with any of these. I personally do use Temp Drop just because I like to have a wearable device that is not, secreting any EMFs throughout the night. And then in the morning, I can just sync it with my phone through Bluetooth, and it tells me what my temperature was. So there are oral basal body temperature thermometers that you can get. You can get these for very affordable rates. The only caveat is that you do have to take it at the same time every morning. So you have to have consistency with them. And it's ideal that you have it in your mouth for 3 to 5 to even 10 minutes before you take your temperature and let it warm up. You want to do it first thing when you wake up, before you get up, before you drink water, before you go on your phone. You want to take it right then. And then there are devices now that you can wear that makes that a little bit easier for you, because it's going to take your temperature as you're sleeping and then give you that number in the morning. So there's Temp Drop, that's taking your axillary temperature under your armpit. There's the Aura Ring, which again is going to be a ring that you wear at night. There's the bracelet, Ava bracelet, the Apple Watch Series Up can track. And then you can use a period tracking app in addition to those devices to track this information. So many apps will come directly with the devices. There's also Natural Cycles, there's Kindara, there's Clue, there's Flow, there's probably hundreds of period tracking apps out there. So take your pick. And then let's see, I also wanted to highlight, so this bottom graph here for Kandara, what is also helpful is that if you are trying to get pregnant, one early sign of pregnancy could be that your temperatures are staying high and they're not coming down. So your temperatures when you're pregnant are going to stay high because your progesterone levels are going to stay high. That corpus luteum is not going to fully degrade, and then eventually the placenta is going to take over, increasing those progesterone levels. So you'll see that instead of coming down like it normally may for you, it stays high and it just stays in that range. That's a sign of pregnancy. So when you're tracking, you can get some of these signs even before your missed period that you might be pregnant. So some cool information there to keep in mind. And then there are a lot of causes that could cause higher or lower basal body temperature levels. So it's important to keep these in mind. So alcohol is one that can increase your basal body temperature. So something to keep in mind, if you are tracking, you have a drink one night or a few drinks and your temperature is suddenly a little bit higher, know that alcohol can cause that. An illness can cause that. Obviously, if you get the flu and you have a fever, that's going to affect your temperature. Low thyroid function, which goes hand in hand with a slow metabolism, can cause those numbers to be in the lower range. So in like the 96s versus in the 97s, which is typically where we want it. Having low protein or a low fat diet, those are so important for good hormone production. So that could be a cause of lower temperatures. Travel is definitely going to affect it. Some time zone shifts can affect it because, again, your temperatures change throughout time. And then there are similar factors that can influence ovulation even taking place. So our body is intelligent. Our body is smart. And it's thinking, is this a safe time for pregnancy? If there's any threat that the body perceives as a stressor, it might push that ovulation out a few days. So this is something that you can track, where if you're tracking your cycle and let's say 1 month, it's a really stressful month, either with your job or a family member passes, and then you see, oh, I typically ovulate around day 14, 16. This month I ovulated on day 18 or day 19. There are things that can push out that ovulation and your body's like, let's wait a little bit. So listed here are some of the things. And then cervical mucus. So cervical mucus is also so important to track, especially if you're trying to get pregnant. I mean, both ways, because it tells you you are fertile in the moment. So again, basal body temperature tracking tells you, hey, you just ovulated yesterday. Cervical mucus tells you you are actively fertile. And so what that means is that this cervical mucus, which is made by the cervix by increasing amounts of estrogen, is going to change throughout the cycle. So you'll have your cycle, and then a lot of women experience a few days where they don't have much cervical mucus, it's more dry, and then it can start to get a little bit sticky, a little bit white, and then switch to more of like a creamy, lotiony feel. And then the very fertile mucus is going to stretch between your fingers and look like egg whites. So there are a few ways that you can pay attention to this. I would say don't rely just on what you see in your underwear. I would fold a piece of toilet paper, kind of pat it around the vaginal entrance, try to look there, or for more accuracy, insert a finger or two vaginally, remove it, and then try to stretch that mucus between your fingers or see how it feels. So this is something that's, again, very important because our fertile window can really be based or extended off of how much cervical mucus we have. Cervical mucus, again, is made by those increasing estrogen levels, and it provides a very hospitable environment for sperm to live. So the acidity of our vagina is usually pretty acidic, and then sperm is a little bit more neutral to basic, and our cervical mucus that gets produced provides more of a neutral, basic environment for that sperm to live in. So this is where that fertile window gets extended towards not just the 12 to 24 hours that you're ovulating, it's the up to 5 days leading up to ovulation, because in this fluid, sperm can survive for up to 5 days in the reproductive tract. So it's super important to keep an eye on that. And here is a graph that's showing menses. Again, this is on average. Some people don't notice like the creamy mucus as much, and they just notice the very fertile mucus. And so you'll see here for this example, there's some sticky, there's some creamy, a little bit sticky again. And then these 2 days, very egg white. And that's typically occurring right around ovulation. Because again, the body is smart. The body knows what it's doing. And this is an important thing if you are trying to prevent pregnancy, is that these rules are going to be a little bit more strict, where once you start noticing any cervical mucus, that's a time to say, I'm going to use a barrier method, or I'm going to avoid intercourse. So during this follicular phase, that's when you need to be very careful if you're trying to prevent pregnancy. And then once ovulation is confirmed, which again, you want to wait a few days to make sure those levels are going up, then you are usually in the clear during that luteal phase. Because once you ovulate and once that egg passes through, there's nothing to fertilize. The next thing is cervical position. So cervical position is also going to change throughout the month, whereas when you're more infertile, your cervix is going to be closed. It's going to be sitting a little bit higher or sitting a little bit lower, and then it's also going to be a little bit more firm. And then during your fertile time, the cervix is going to open up slightly because it wants to allow that sperm to go through. It's going to feel a little bit more soft and a little bit more open. So you can actually check the position of your cervix by inserting 2 fingers vaginally, and you're feeling for something that feels like about like the tip of your lip. And when it's a little bit more closed, it might feel more like your nose. So that's something to keep in mind. It's going to feel a little bit harder. So that's something that you can also check around that time where you're noticing the cervical mucus. It might take time too of tracking for a bit to notice. And then LH strips. So LH strips are another thing that you can use to help you determine if you're about to ovulate. So if you all remember, LH is going to surge 1 to 2 days prior to ovulation. So you can pee on these little LH strips and try to better determine when you're about to ovulate to help you either have intercourse or avoid intercourse, or again, use a barrier method. So you'll see here on the chart on the right, this is not like a COVID test. So I always tell my patients that a line being there does not mean it's positive. You want a line that is as thick or darker than the control line. So you'll see here these 3, it's darker. It's darker or just the same color as the control line. This is showing that your LH surge is surging and you're about to ovulate. However, there's a lot of caveats about LH strips, because if you, for one, have PCOS, which we'll talk about soon, one could have high LH throughout the month. You could have multiple LH surges. Even if you don't have PCOS, it's more common with PCOS, but I have had a few patients where their LH will surge a little bit and then come back down and then surge and then spike. So you're really looking for that peak. So this is something that you would pee on between 12 and 6 p.m. So pregnancy test, you want to use that first morning urine because it's going to be much more concentrated, whereas LH strips, you're really trying to detect that peak and that surge. So you want to use that 12 to 6 p.m. window to keep it similar day to day. And then I don't know if I said this at the beginning and we're already almost at the end, but if you have any questions, please add them into the chart. Most of the people that attend these webinars know that already, but yeah, go ahead and add some questions and I will answer them at the end. So your window, I know I alluded to this already, but your fertile window is truly the 5 days leading up to ovulation and then the 12 to 24 hours of ovulation. So as women, our fertile, time with the egg is really just 12 to 24 hours. But because sperm can live in the reproductive tract for up to 5 days, we need to include those 5 days prior to ovulation as well, especially if there's an abundance of cervical mucus there, because that cervical mucus is there to be a friendly environment for the sperm. PCOS. So PCOS can make it a little bit more tricky to track because of the irregular cycles. I still think it's so important for women with PCOS to track their cycles because it can give us good information. And again, if they are trying to get pregnant, we can see how many little, times of cervical mucus are you having? Are you having lots of attempted ovulations, or are you having just dry mucus throughout months and months? So it's something to help us when we're trying to regulate those cycles or trying to help someone get pregnant. So what can be difficult is that you might have high LH throughout the cycle. So if you're using those LH strips, you might have multiple high LH surges, and it's just because your LH is on the higher end because your body's trying to ovulate. You can also have those episodes of attempted ovulation because you're having these little, 3 to 5 day windows of an abundance of cervical mucus, but then you don't see your temperature rise. So okay, my body's trying, but I didn't ovulate this cycle. So it's really important to track. Tracking the cycle can tell us so many things about our health, more than just our fertility. Again, it can tell us about our metabolism. It can tell us about our thyroid. So sometimes just looking at a chart, you can not necessarily diagnose other conditions, but be on the lookout to look further into other conditions that may be affecting the cycle. Okay, assessing and supporting balanced hormones. I could do an entire webinar on just this, but I wanted to bring in some information here. So bringing in your chart to your provider is definitely going to be something that you can do. Hopefully your provider is, aware of the Fertility Awareness Method or aware of how hormones change throughout the cycle. If you're going to one of us here at Living Wellness, we will be aware, and then your OB-GYN will be aware. So it depends on who you're going to, but you can bring in your chart, bring in the numbers, and then laboratory assessment on specific cycle days. So based on the information I shared previously, hopefully that makes it clear why we want to test hormones on specific days of the cycle when we're testing them through the blood. So on day 3, we're typically checking estradiol, which is our most prevalent form of estrogen when we're younger, more fertile. We're also going to check FSH and LH to see what the ratio of those two are. And then we want to check progesterone and estrogen around day 19 to 22 if your cycle is one that ovulates around day 14 to 16. So the most ideal is to check progesterone and estradiol 7 days post-ovulation. So tracking your cycle gives you that specificity where okay, I confirmed ovulation. I'm going to go get my blood work drawn 7 days later. And then there's not a guessing game because when someone is not tracking their cycle, we just kind of assume it's around day 12 to 15 to 16. We don't know. So that's another, again, little not dig on for the method, but using those apps to just tell you you're likely going to ovulate around day 14 is not accurate. You need to be tracking other things. And then nutrition. So this is how we can support our hormones. We want to make sure, again, we're getting good protein, good fat, good carbs. This is all going to fuel our body and help produce those hormones. Sleep is crucial. So getting poor sleep is definitely going to throw off the hormones. A lot of those devices that track your hormones require you to be asleep for at least 3 hours to get a measurement. If you're not asleep or at rest for a long enough time, it's not going to pick up on a temperature reading. Stress management, again, is huge. As I talked about, stress can push out ovulation. So we want to make sure to our best ability, we're partaking in self-care, we're setting our boundaries, we're not overworking, and really, trying to keep stress as managed as we can in this stressful world. And then nutrients, these are a little bit more specific to progesterone because progesterone is, again, very important during the luteal phase. These are also important to estrogen. So we want a good ratio of the hormones. We don't want estrogen too high. We don't progesterone too high or too low. It's a very delicate dance between the two. So some nutrients that support our hormones: magnesium, our B vitamins, specifically B6 for progesterone, vitamin C, vitamin E, zinc, inositol, and then herbs. So Vitex. Vitex can tell our bodies to produce more LH, and then that can lead to improved ovulation with more progesterone. Evening primrose oil, ashwagandha, holy basil, a lot of our adaptogenic herbs that are going to support our stress response and our adrenals. And so I wanted to just do a little overview, and I thought that this picture was really cute, so I included it here. These are some myths that I would say we dispelled during this talk. Hopefully I did a good job at dispelling these. I think so. So tracking your period is the same as tracking your cycle. I think I hammered that home talking about the rhythm method. So just tracking your period is different then tracking your cycle, tracking your basal body temperature, tracking your cervical mucus. I would say, again, if you're relying on this method for contraception or to get pregnant, you want to be tracking more than just the days that you are bleeding. Another myth, you are fertile all month long. I don't know if your high school or middle school told you this, but I thought this growing up, that you can get pregnant on any day of the month. But really, your fertile window is 6 to 7 days. Those 5 days prior to ovulation and the day of ovulation. And then ovulation is on day 14. It's not true. That, again, can vary month to month, should be within a few day window, but some people consistently ovulate on day 12, other people on day 18. Both of those are normal. And then vaginal discharge is always abnormal. Not true. If there's a smell, if there's an odor, an itch, a color, yes, that might be abnormal, but our bodies are producing cervical mucus, especially in that follicular phase, and it's intentional. It's there for a reason. So I always have heard stories, of women going to the doctor every month around the same time, thinking that they have an infection, and really, in fact, it's just their fertile cervical mucus. So keep that in mind. And once you are aware of this information, it makes it a lot easier to track, because some women as well tell me, I don't really have much cervical mucus, or I don't really notice it, or I feel like I have it all month. But once you start noticing the differences between the stickiness, the creaminess, the egg white, then hopefully you'll be able to differentiate those. And then I think I hammered this one home too. So important points. Our bodies can change month to month. You don't want to use your information from last month to predict the next month, especially if you're trying to avoid pregnancy. So you want to use all the information. The more information you use, the more accurate you can be with this method to either prevent or to promote pregnancy. So you want to look at your cervical mucus. You want to see your cervical position. You want to absolutely take your temperatures all month long to make sure that you are confirming when ovulation happened. And then also you can use late strips to give you even more information. These are some resources. I have my Taking Charge of Your Fertility book right here. It's really like a Bible. It's thick. It is such a good book. It goes really in depth on different cycles, what different charts can mean, and it's an amazing book. And then there's also the book, The Fifth Vital Sign, and the author of that book has a podcast called Fertility Friday. It's amazing. You can go to fertilityfriday.com, and she has a whole series of just fertility awareness method podcasts that you can listen to get more information. There are some fertility awareness classes that are held in your local community. So that's something that you can Google and actually attend a class with other women. That would be a lot of fun, I think. And then YouTube, there's a really cool channel that I like called Live Fertile, and she talks about the fertility awareness method there and some of the ways that she tracks. And then, of course, your Living Wellness Naturopathic Physician. I love talking about this information. It really just makes me feel good to share this information with women and their partners and everyone in the world, to educate them on what's happening in their body and educate them on some of the changes that we can see, because I think the more information you have, the more empowered you are to take your health into your own hands and to know what's going on. I think that's really interesting. So now we will do a Q&A. Let me open up the chat. Okay. Any notes for those of us waiting for a period to return after breastfeeding? Is it normal for period to not return until the baby is fully weaned? When does it return? How long can it take to normalize? So this is different for everyone. So there are some women that are, breastfeeding only 3 to 6 months and already get their cycles. And then for other women, it might take time once they are done breastfeeding and fully weaned to see a cycle. So some of this depends on the hormone prolactin. So prolactin is released when we're breastfeeding, and that can suppress ovulation. And so I would say if you're fully weaned and you haven't got a cycle back in 3 months, maybe 6 months, that would be a time to get your hormones assessed by your provider, and we can measure those hormones. Usually postpartum, they are pretty low across the board, but it would be a good time to get those hormones measured and see exactly what's going on, because that lab work can be really helpful to determine. Okay. How many days post-ovulation can you take a pregnancy test? So this, again, is some information where when you are tracking your cycle and you start to notice that your temperatures are staying high, that could be an early sign that you are pregnant. So ideally, you want to wait 12 to 14 days post-ovulation, which is going to be around the time of your next cycle or next period, or when the period is predicted to be. But implantation can happen as early as 6 days, so 6 days post-ovulation, and then it takes about 48 hours to HCG, the hormone that is detected on the pregnancy test, to be positive. So some women can get a positive pregnancy test 8 days post-ovulation, which is pretty early, compared to when they were due for their next cycle. But I would say, waiting a good 12 days or, 14 days, because you can implant as late as 12 days. And then you're not going to have that positive pregnancy test until day 14, which is likely when your next cycle would be anyways. So if you take a pregnancy test around day 8 post-ovulation, day 9, and it's not positive, that doesn't mean that you're not pregnant. What are the signs of ovulation? So some individuals have signs and some individuals don't. You can have a cramping pain on the side that you ovulate. So we don't ovulate from both sides. It goes back, not necessarily back and forth. It could be the right side, the left side. Some women notice a little bit of pain or even a good amount of pain when they're ovulating because of that follicle rupturing and releasing the egg. Some women are just more sensitive to that. You can have an increased libido, so that's very natural to have around ovulation. Again, that egg white mucus is going to be present, and so that's a really good sign that's indicating either ovulation is coming or ovulation is here. What temperatures are considered normal? So in the textbooks, they say anywhere from 97.0 to about 97.7 is the average range in that follicular phase, so that first half of the cycle. And then the second half of the cycle, we want to see them in that high 97 to 98 range. Again, this can vary women to women. If they're persistently in the 96s, or even if there's any in the 95s, that is usually going to mean that there's either slow metabolism, thyroid dysfunction, not enough protein in the diet. So yeah, that would be an indication that you want to get other labs to assess those things. So to assess thyroid function if they are persistently low. Another thing to check though is what method you're using to take those temperatures. So I would say if you're getting readings in the 95s and 96s, use another method. So if you're using a wearable device, also use a thermometer. The oral and vaginal ones will be a little bit higher than the one that you wear on your finger or on your wrist, most likely, just because of the positioning and how close they are to our core. So they might be a little bit higher. And so use another method to check that instead of just relying and being worried about really low temperatures. Okay, last question. Does having egg white cervical mucus mean you will ovulate? No. So again, as I was saying with women with PCOS, just having fertile mucus or egg white mucus does not necessarily mean that ovulation is going to happen. It means that your estrogen levels are increasing and your cervix is making more of that mucus, but you need to also use that temperature to see, okay, I did ovulate. And then also, kind of going back to that first question about postpartum, tracking your cycle postpartum, again, is going to be tricky, similarly to PCOS, because you might not be having a cycle. So you might just be riding in those low temperatures where it's typically, in that follicular phase, because you should not be getting a cycle without ovulating. Again, you can have anovulatory cycles, but most of the time it's going to be from ovulating. And so if you want to, again, check your temperature, pay attention to cervical mucus, that might be a good sign of, oh, I think I'm going to start getting my period again. Because if you're seeing that discharge and you're seeing those spikes in temperature after you ovulate, you really should be getting a cycle 10 to 14 days later, or sometimes 16, but 10 to 14 is the most average. Okay, I think that is all for today. So I hope you all learned something from this webinar and can take away some good information. If you have any questions and you are currently a living wellness patient, you can reach out to your provider. You can message me. And if you need any more resources, just let me know, because again, it's really fun to talk about this. So I hope you all have a lovely weekend, and I'll see you next time.